Hi, y'all. My name is Claudia Lennhoff, and I'm the Executive Director of Champaign County Healthcare Consumers, and I am joined by my coworkers, Adani Sanchez and Chris Garcia. And this is our presentation for the Affordable Care Act's Marketplace Open Enrollment period, which we are now in. So welcome to this presentation, and we hope that this will help answer many of your questions. So just a quick review of the goals of the Affordable Care Act, just so that we're all on the same page. Remember that the purpose of the Affordable Care Act, which created the marketplace, the purpose of it was to expand health insurance coverage, because when the ACA, the Affordable Care Act, was first passed, we had over 50 million Americans who were uninsured, and the numbers were continuing to go up. Another purpose of the Affordable Care Act was to improve coverage for those who already did have health insurance, and also to improve access to and quality of care when going to get health care, and to help control the rising healthcare costs. So the Affordable Care Act was actually implemented across a number of years. And this slide here, I won't go into all the details on it, but you can see that when it was first passed and implemented in 2010, a lot of the changes that the Affordable Care Act brought were actually changes to existing health insurance plans, whether those plans were from employer-based health insurance plans or just plans purchased on the individual market. And remember that it began by expanding adult dependent coverage until age 26, and it removed a lot of the barriers that used to be really harmful to consumers, such as the lifetime caps on health insurance, the ability for health insurance companies to rescind their coverage, or to deny you coverage or charge you differently based on pre-existing conditions, and so on. So the Affordable Care Act started out in 2010 with making really significant changes to all forms of health insurance, and these changes continue today. Then in 2011 to 2013, there were some other changes that were made. And then finally in 2014, we saw the huge expansion that resulted in covering many of those 50 million uninsured Americans. And a lot of that expansion was due to the health insurance marketplaces, and also to states that chose to expand their Medicaid program, such as the state of Illinois. And that made a huge difference in the lives of people. So again, one of the really important things to understand about the Affordable Care Act is that there were many new benefits and protections that were added to health insurance, and not just health insurance that was created by the Affordable Care Act, but already existing health insurance. The health insurance that you get from your employer, or the health insurance that you would get through a private plan that you would just purchase individually. And again, some of those benefits are listed there on this slide, including allowing adult children to remain on their parents' plans until age 26, and then making sure that certain preventive services would be covered with no out-of-pocket cost for the person, including, well visits and annual checkups and OBGYN appointments and things like that. And then another thing that the Affordable Care Act did is it made sure that prescription contraceptive coverage and STI testing and counseling would be covered with no copays whatsoever. And then it added protections, the protections that we needed for so long, like no lifetime caps or limits on your health insurance, making sure that your health insurance companies could not drop your coverage because you had an illness. And I've been doing this work at Healthcare Consumers since, well, for a long time, over 20 years. And I can tell you that I was working with consumers before the protections brought by the Affordable Care Act. And it was not at all unusual for us to have clients who came to us in desperate situations because they had been diagnosed with cancer, for example, and then the health insurance company that they had had for years would send them a letter with a check reimbursing them for their last few months of premium payments. and a notification that they were being dropped because of their new cancer diagnosis or whatever their health issue was. This happened all the time. And then it was very hard for people to get insured after that because now they had a pre-existing condition. So this is one of the really super important things about the Affordable Care Act that we don't want to lose as a nation. And then there's a couple of other protections that help also lower the cost of insurance for people. Okay, one of the other great benefits about the Affordable Care Act is that it has several different ways to make health insurance more affordable to people, because that was the other problem, is that the cost of health insurance was just getting so unaffordable, even if people didn't have pre-existing conditions. So insurance is made more affordable in 3 ways under the Affordable Care Act. And one of the ways is by providing financial assistance in the form of advanced premium tax credits to people who have incomes between 139% and understand that a huge proportion of people who get their insurance through the marketplace also receive a subsidy to help make their insurance much more affordable to them. A second way that the Affordable Care Act makes health insurance more affordable is by providing out-of-pocket cost sharing for those with incomes between 139% and 250% of the federal poverty level when purchasing silver plans. So when people purchase silver level plans with the cost sharing support, those plans end up actually having actuarial values of a gold plan. And we'll talk more about that later on. And then a huge way that the Affordable Care Act made health insurance more affordable is by allowing for the expansion of Medicaid to those who have incomes up to 138% of the federal poverty level. This was huge, and we are so glad that the state of Illinois chose to expand their Medicaid, because now people who worked in restaurants or bars or jobs basically that paid lower wages could now actually qualify for Medicaid. And Medicaid covers everything, and it has no monthly premium, it has no deductible, and it has very low or no copays whatsoever, and it covers all kinds of benefits. It's actually one of the best health insurances that you can get if you want, really full coverage and no out-of-pocket expenses. So these are really important advancements in health insurance affordability for our nation, and you can apply and qualify for any of these that you might qualify for through the marketplace. So now we're going to talk about the actual health insurance marketplace at healthcare.gov. So what you need to know about the marketplace is that there are new affordable options available for people without health insurance. All plans have to cover doctor visits, hospitalizations, maternity care, emergency room care, and prescriptions. And again, financial help is available so that you can find the plan that fits your budget. And all insurance plans have to show the costs in simple language with no fine print. And this is what makes it possible for consumers using the marketplace to compare one plan to another plan. So the health insurance marketplace in Illinois, we have a partnership with the federal government, and our partnership is called Get Covered Illinois. The health insurance marketplace, which is at healthcare.gov, is a one-stop shop where people can enroll or find out if they are eligible for private health insurance plans with subsidies or Medicaid. And so this means that our marketplace is both federally and state run. And it'll basically step you through to help you figure out which type of health insurance you qualify for and are eligible for. People can enroll through the marketplace online at healthcare.gov or over the phone, and the phone number is listed there. It's 800-318-2596, or by using a paper application. although we don't necessarily recommend that. Open enrollment in the health insurance marketplace has already started. It began on November 1 and it goes through December 15th, 2020. It's really important to understand that you only have a month and a half to enroll in the marketplace if that is where you're going to get your health insurance. We used to have 3 months under the Obama administration, and then now under the Trump administration, they have cut that in half, and they have severely reduced any funds for outreach and education for the public. And that's why this presentation is so important. And you can really help us by making sure that everybody who needs health insurance, who might be getting it through the marketplace, that they understand that the clock is ticking and open enrollment ends December 15th. So it's important to understand that when you enroll in health insurance through the marketplace, this is for health insurance that will begin on January 1, and you must enroll by December 15th. People will find out if they are eligible for Medicaid or premium subsidies, those advanced premium tax credits that help make the insurance more affordable, or cost sharing subsidies, all through one application. Now, there are special enrollment periods. So the people who can enroll outside of the open enrollment period, which again ends December 15th, they have 60 days based on certain circumstances. So for example, if you lose insurance from a job in February of next year, you will get a special enrollment period. If you have a baby, or if you move to a new zip code, or if there's some significant change in your tax household, or if you are a young person who turns 26 and you are now losing the coverage that you had through your parents' health insurance, you will qualify for a special enrollment period. And there are other circumstances that can help qualify somebody. So just keep that in mind. If something changes, you can always reach out to us and we can let you know if you qualify for a special enrollment period. So let's talk about who can shop for health insurance in the marketplace. First of all, the marketplace is for uninsured individuals, also for people on individual health insurance plans, people who are looking to purchase dependent coverage, people with COBRA health insurance. COBRA, that's the program that can extend your employer-based health insurance once you're no longer employed anymore, but it can be very expensive because under COBRA, you are now paying your part of the premium for your health insurance, your monthly premium, plus your employer's part of the monthly premium. So it can get very expensive. If you have COBRA, we really encourage you to check out the marketplace. And also self-employed people with no employees. And it can be families, it can be small businesses, it can be also people who do have health insurance, but where it is unaffordable to them. And the federal government defines unaffordable as more than 9.78% of their annual income. Also, people must be US citizens, visa holders, or permanent residents with green cards. So the people who cannot shop in the marketplace are people who have Medicare. So if you have Medicare, the marketplace is not for you, and you should visit our other presentation on our Medicare open enrollment page. People who have Medicaid should not be shopping in the marketplace. They're already covered. They already have the best insurance available and the most affordable insurance available. Also, individuals who are currently incarcerated and are serving a sentence, they are not eligible, and undocumented individuals are not eligible. So what will marketplace plans cover? So plans purchased through the marketplace will be considered qualified health plans, and they must include coverage of these 10 essential health benefits at a minimum. And that includes ambulatory patient services. So that's like just going for a doctor's visit, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder services, prescription drugs, rehabilitative and habilitative services and devices, lab services, preventive and wellness services and chronic disease management, and pediatric services. Also, I want to make note to just mention that other health insurance plans, including ones that are employer-based or individual plans that are compliant with the ACA, also must cover these 10 essential health benefits. So just a quick word about adult dental coverage in the marketplace. Under the Affordable Care Act, dental insurance is unfortunately treated differently for adults and children 18 and under. So dental coverage for children is an essential health benefit in the marketplace. This means it must be available to you as part of a health plan or as a freestanding plan. Unfortunately, this is not the case for adults. Insurers do not have to offer adult dental coverage. So we're still working on that aspect of health insurance to get health insurance companies to recognize that the head, our mouths, and our eyes and our ears are part of our bodies and part of our health, and that the things that we need for those parts should be covered, but we're not there yet. However, some plans may offer dental coverage, and you can also purchase standalone dental insurance through the marketplace, but only if you are also purchasing a health insurance plan through the marketplace. So at this point, I'm going to turn it over to my coworker, Adani, and she will take you through the next section.
Hi, everyone. I wanted to talk about getting into the details of the actual health plans. So again, we're on the marketplace. We're looking at the variety of plans that are available, and they're going to be categorized in 5 different levels of coverage: catastrophic, bronze, silver, gold, and platinum. In Champaign County, we only have up to gold, but the idea is that these different levels of plans are not qualitative. It's not that one is the worst or one is the best, but the idea is that these are based on actuarial values, and these plans, whatever category, will cover a certain amount of your medical costs. So for a silver plan, it will cover about 70% of the total average costs of care for an average person. So the idea is that the higher you go in the metal level, the more comprehensive your coverage will be, the more that their health insurance plan will pay for your medical services. That also means that your premium is most likely to increase as your metal levels increase as well. The level of coverage, again, the plans are going to look different. They're not all going to be the same. When we talk about bronze, silver, and gold, we're not talking about every one of those plans in those categories is going to cover 80% or 70%, and then you pay the other that's left over. Those benefits are actually going to vary. Deductibles are going to be different. Co-pays are going to be different. Co-insurance is going to be different. But the lower level of the plan, the lower your monthly premiums, the higher your out-of-pocket costs might be. So even though your premium is really low on a bronze plan, you're going to have to pay more when you actually go to the doctor's office. All the plans will have a maximum out-of-pocket limit, and that's a cap. So, you can't spend more than so much out of your own pocket. If you reach that limit, the health plan has to cover all of your costs for the rest of the year. And all levels will have to cover all 10 essential health benefits. So that's going to be true all across the board. Catastrophic health plans are available to individuals under 30 years old. Individuals age 30 and over who have received a hardship exemption may be able to buy a catastrophic plan. These tend to have cheaper premiums, but they don't cover as much at the doctor's office. So again, they're going to be even less coverage than a bronze plan. So very low coverage. It's kind of like, at $8,150, that's the most that you would have to spend if an emergency happened, but they're really not going to help cover stuff kind of between that. So in the marketplace, catastrophic policies will have a deductible of $8,150. So you have to spend that much out of your own pocket before they start discounting your medical care. If you buy a catastrophic plan on the marketplace, you cannot get financial assistance based on your income. So you're going to have to pay full price for a catastrophic plan. in Champaign County specifically, we've got 2 companies that are offering plans, Health Alliance Medical Plans, Blue Cross Blue Shield of Illinois. For most individuals and families who did not qualify for Medicaid, there are going to be about 15 to 17 different plans available for them to choose from. The premium for the cheapest bronze plan has actually decreased this year. So the decreases are between 5 and 10% for our area. So that's a good thing. That doesn't always happen. And I wanted to talk a little bit about how to actually compare and look at these plans. So on the marketplace, you will be shown a list after you enter your information. You can also window shop and see this list of plans, and you'll be able to see all the plans available. You can enter specific information like income, age, gender, to see exactly what options are available to you. So in our example here, we're going to be comparing a bronze plan and a silver plan for a 40-year-old female with an income of $30,000. So the biggest thing, and probably the thing that people are most interested in looking at, is how much is this going to cost? So you can see that's the first thing here on the left side. The premium for this bronze plan is $83.78. Because we entered our example's income of $30,000, we find out on the marketplace that she has a tax credit of $341. And you can see right under this premium amount that the sticker price for this plan is $425. So the $83 that we see reflected here has already taken into account what her subsidy is. And again, this is a bronze plan, so we know that there are going to be more plans available. They might be more expensive, so this is going to be on the cheaper end. This is actually the cheapest bronze plan available. The deductible is $6,750, and that's also the out-of-pocket maximum. You can see down here, there are common medical services that someone might need. So going to the emergency room is no charge after deductible, which means that you will have to pay, every time you go to the emergency room, you will have to pay the full price of that until you hit $6,750. And then it will be free. So there's a lot of out-of-pocket costs there. So this is the same benefit for generic drugs, primary care doctor, and specialist doctor. So think of this as kind of, if you don't go to the doctor a lot, maybe you want to go to a bronze plan. You have something just in case to prevent really high out-of-pocket costs, but you don't really get a lot of regular care. You don't have prescriptions. You don't go to the doctor very often because this is going to be a really high out-of-pocket cost if you do end up going to the doctor or using a lot of medical services. Okay, and let's go to the next one. And now we can see that we're still going with our same example, a 40-year-old female with an income of $30,000. And now we've moved up to the cheapest silver plan. You can see here the premium is much higher than that bronze plan. The sticker price is much higher as well. And then she has also qualified for extra savings. So this is the discount that we were talking about that's called cost sharing reduction. So that's what that little yellow rectangle is referring to. In this situation, our example qualifies for a reduction in copays and deductibles. So you can see here the deductible is $1,000, which is cheaper than it usually is for someone else who was not getting a cost sharing reduction. You can see here when we go back to the services, The primary care doctor has a flat fee of $10. So that's helpful for someone who just goes to the primary care doctor. But you can also see that generic drugs, the prescription benefit is not as comprehensive. It looks more like the bronze plan, where you have to pay your deductible. You have to pay $1,000 first before you can get a 50% discount on your generic prescriptions. So this is going to be the work that folks will have to do when they go onto the marketplace, is just looking at these plans, seeing how they compare to each other, and then taking into account what each person needs based on their usage of medical services, based on what they're looking for. So it's really just going to vary depending on the person. Again, things to take into account is your income. You might qualify for more of a subsidy. You might qualify for less of a subsidy. Your age is also still taken into account when they're coming up with the pricing for these plans. And then, of course, if you're a smoker or a non-smoker, so they can still ask that, even though they can't ask about any kind of pre-existing conditions or anything like that, they will still be able to ask you whether or not you're a smoker, and that will affect the price of your premium. Again, this is just to review the way that health insurance is made affordable. They are giving you financial assistance based on your income. So for people who have between 139% and 400% of the federal poverty level, those folks will qualify for a tax credit. And so you can see how that was reflected in the premium plan that we looked at previously. The premium will already have the subsidy reduced, but then you can see the sticker price after that. And then the cost sharing reduction. Cost sharing reductions are an additional discount. You can have that in addition to the tax credit, and that's for people who have incomes below 250% of the federal poverty level, and that reduces the deductibles, co-pays, and that will be signified by that little yellow box that says extra savings. And then for people who do not qualify for the marketplace or do not have, who have lower incomes, there is Medicaid, and so that will be something that the marketplace can tell you if you qualify for, but you wouldn't be shopping for Medicaid plans like you would for a private insurance plan. A premium tax credit is a refundable credit that helps reduce premiums for health insurance purchased through the health insurance marketplace. And about 80% of the folks buying on the marketplace qualify for a tax credit. The tax credit can be taken in advance and paid to the health insurance company to reduce your premium, or at the end of the year in a lump sum. So you actually have the option for how you want to take that tax credit, but it's most common to take the tax credit in advance and then reconcile the differences at tax time. The subsidies change every year based on the federal poverty level, which slightly increases every year. And you can only get a subsidy through healthcare.gov. So even if you were interested in buying an individual plan, you would still have to go through healthcare.gov to actually get the financial assistance for it. So if you went directly to a broker and they said, sometimes they can help you with healthcare.gov and they can go through the marketplace with you. But if you were to go directly to a broker and ask for off-marketplace plans, you would not be able to get a subsidy for those plans. Cost sharing reductions. Cost sharing is the part of health insurance where the consumer has to pay for healthcare costs. So that's why I keep saying deductibles, copay, co-insurance. So when you're eligible for a cost sharing reduction, it discounts those specific parts of the health insurance plan. So deductibles, copays, and co-insurance. And you can only get cost sharing reductions for silver plans. So you can't choose a gold plan and get a discount on the deductibles or the copays because it only works for silver plans. And that's how some of those silver plans become just as comprehensive and just as covering just as much as a gold plan, is through cost sharing reductions. And you can actually see here, we've been talking a lot about these percentages at these federal poverty level. And so you can actually see what that looks like for 2020. Healthcare.gov, even though you're choosing a plan for 2021, healthcare.gov uses 2020 federal poverty levels to figure out how much of a subsidy you're eligible for. So I'm going to take out my pencil again, and you can see here At below 139% of the federal poverty level, that's where someone might qualify for Medicaid. So that's for one person, about $17,609 a year. You would more likely be eligible for Medicaid. And then going up beyond that, all the way up to 400% of the federal poverty level, which is $51,000 a year. And that's where you could still get some financial assistance on the health insurance marketplace to buy a private plan. However, you do get less financial assistance the higher your income is. So it is graduated. So just keep that in mind when you're looking at the plans. And when you're on the marketplace, you do have to enter in what your income is. And so what they're counting as income is wages from a job, salaries, tips, any kind of income from a job, net income from self-employment or business. Generally, it's the amount of money that you take in minus your business expenses. So they generally will take into account some expenses that you have if you're self-employed. Any kind of unemployment compensation, Social Security payments, even though Social Security payments are not taxable, those do still count as income. So that'll be something important to keep in mind. Alimony, retirement income, investment income, pensions, rental income, and then other taxable income. Things that don't count are child support, gifts from relatives or friends, and supplemental security income, veterans disability payments, workers' compensations, and any kind of proceed from loans. So if you're a student going to school and you received a loan to cover costs for your education, that would not be considered income because those are applied to, those have already been earmarked for certain costs. Expanded Medicaid, going to explain a little bit more about that. Another way that insurance has been made more affordable is by expanding Medicaid. Here in Illinois, they did choose to expand Medicaid, so that has made it a lot easier for people with lower incomes to have access to health insurance. It's often called the medical card or public aid. Medicaid is health insurance that's offered by the government, and it will cover the 10 essential health benefits just like the private plans offered in the marketplace. Expanded Medicaid for adults has no monthly premiums. It was expanded in 2014, and the income limit went up slightly, and categorical requirements were removed to allow more individuals to qualify. So in Illinois, you used to have to meet a certain category in addition to meeting an income threshold. So maybe you had to be a parent or you had to be considered disabled to qualify for Medicaid and have a low enough income. But now the categorical requirements have been removed. So now the only requirement is to meet a certain income threshold. Medicaid will not be looking at assets. So they are just looking at what income is coming in based on those that list of income elements that we looked at. But they will not be looking at bank accounts for the adult category. However, for individuals who are over 65, that is something, if you're over 65 or considered disabled, they do look at assets, but that's a separate presentation. You can apply directly to Illinois Medicaid at abe.illinois.gov. And this is a little bit more information on Medicaid because Medicaid does have some options. So we talked earlier about how people can choose different options for private health insurance on individual plans. Medicaid kind of has something similar. When you qualify for Medicaid in the adult ACA category, you will have a couple of options. The differences are just kind of in the extras that they offer, and then also the networks that they each have. So this is just kind of a chart showing what the different options are here in Champaign County for Medicaid plans. And so again, the thing to be considering here is where do you go to the doctor? And then what extra benefits are you interested in? Are you interested in having a lot of over-the-counter products mailed to your home? Are you looking for transportation to other places besides medical providers? So this is what they're called managed care companies. And then the program is called Health Choice Illinois. And so these are going to be the ways that you compare these, because they're all Medicaid plans and they all have to cover what Medicare covers. It's just the differences are more around what extra benefits do they offer. And now I'm going to hand it over to my coworker, Chris Garcia, who will share with us what it takes to get ready to enroll.
Hi, everyone. So I'm just going to go over some tips and things to know for getting ready to enroll. So the first thing is you want to gather all your information. So through the application, you'll have to submit information about your family, for example, birth certificates, social security numbers, and household income. So that means everyone who's employed in your tax household will have to be included. The application may need documentation, so you might have to actually submit those documents either by uploading them directly to the online portal, or you can mail them into the marketplace as well. If you have a preference on where you get care, you might want to have a list of your doctors, maybe the pharmacies and things like that, so you know the prescriptions, and you can input that information on the tool so that as you're navigating the plans, you can see which plan might be a better option for you and your needs. And if you believe you may qualify for Medicaid, you can go directly to the Medicaid application at aid.illinois.gov. But again, you can also go through the marketplace, and if you're not sure which you qualify for, they will give you a determination for that. So some tips on the terms that are being used. So again, the premium is the amount that you pay on a monthly or after those credits have been applied. The cost sharing is what you'll see in the discounts for the copayments, coinsurance, and the deductibles if you qualified and if you were within that income range. Your deductible, again, is a feature of the health plan in which consumers are responsible for healthcare costs up to a specific dollar amount. So you have to meet that deductible sometimes for a lot of the benefits to kind of kick in a little additional benefits. And then the out-of-pocket maximum is the annual cap of money that you, the individual, will be required to pay for healthcare costs, excluding the premiums. And how to actually apply. So there's a few ways. Healthcare.gov, again, is going to be a one-stop shop where you can kind of submit and it'll give you a determination. You can also go directly to aid.illinois.gov, and that is if you know specifically that you are within the income range for Medicaid. You can use the tool through healthcare.gov to kind of see what that might be if you don't want to submit an application right off the bat and kind of explore your options. The other way you can do an application or submit an application would be by phone. You can call the National Health Center or the call center at 800-318-2596. You can also submit a paper application, but that's probably the least recommended option. And if you have questions about this, you can still seek remote assistance with applications by calling CCHCC. Again, where you can get help with enrollment. So people that are applying for private insurance and Medicaid, you can go through the health insurance marketplace. We are not doing in person, but again, you can also contact us to set up appointments and do remote appointments and go over what your options might be during the window. So again, November 1st through December 15th. and that is for insurance to start as early as January 1st. If you are renewing your coverage, again, we highly recommend that you check what your options are for the upcoming year. So review your current plan for this year, see if there's any changes. You should be receiving 2 notices, one from the actual insurance company about the rates that you'll be paying, so that's your premium, and then one from the marketplace about the tax credits. So again, because the prices are based on the federal poverty level, that changes every year. Your income might change, the tax credits might change. So if you want to maybe get a different plan, see what the prices are going to be for the next year, we definitely recommend reviewing those options and going back onto the marketplace to see what is available. And you want to compare your plans again, making sure that your prescriptions, that your doctors are still going to be in network with your plans, and make sure they choose the best one that meets your needs. Again, December 15 is the key date for making sure that you have a plan starting January 2021. If you are unhappy with the decision that was made about your eligibility, you can also appeal that. So for the marketplace, you can appeal directly by mail. You can fill out the actual appeal request form that's online on healthcare.gov, or you can just write your own letter stating why you are unsatisfied with the decision. Make sure to include the application ID, because this is how they will identify you and be able to pull out your case and see what the discrepancies might have been. Exemptions for the individual responsibility payment. So this is has changed in the last few years, but we'll go over some of what you might be seeing under special circumstances. So there will not be a penalty if you do not have insurance for 2021. But there are specific circumstances where you could apply for exemptions. Again, if your employer income is above the 9.78% of your income towards health insurance, for your annual income, you can apply to opt out of those plans and into the marketplace. If you were incarcerated, or if you are below the filing threshold for tax returns, you can also apply for exemptions. Hardship exemptions are the following. So if you faced an eviction or you were evicted in the past 6 months, if you were homeless, if you received a shutoff notice, experienced domestic violence, filed for bankruptcy within the last 6 months, or had medical expenses in the last 12 months resulting in substantial debt. So these are situations where you might qualify for a special enrollment due to change of income, change of zip code, things like that. There are other exceptions based on the individual needs and situations, and we can give you a more extensive list and kind of go over your special circumstances and see if this is something that you should pursue, and we can help with those processes as well. And on this slide, we're going to be going over the Affordable Care Act and going forward. So currently there are still threats to the ACA. For example, on Sunday mornings, the healthcare.gov site will be down. So you will not be able to submit applications during that time. There is still also a Supreme Court case being heard. And then there are short-term plans that are being offered by providers. Again, we definitely encourage you to take close look at what these plans are offering. They do not include the 10 essential benefits. You can pick and choose what services you want to be covered. But for example, if something comes up and you happen to need the thing that you left out because it made get back onto the marketplace or even start a marketplace application, because that would not qualify as a special enrollment situation. So again, we definitely encourage you to look closely at what those plans are. Make sure that they are qualifying health plans when you are discussing what the options are, even if you choose not to go through the ACA. There are also still threats to Medicaid. So there are work requirements implementation, issues expanding. Luckily, we were able to expand a few additional states, but there are still issues like public charge, which are scaring people from applying for benefits, even though they might be eligible. What you can do to help. So we encourage you to share this presentation, to follow us on social media, check out our website. Our presentation will be available there as well. And then you can stay up to date on changes that are happening, and you can reach out to us if you have questions about how to move forward. Here are some of the links to the resources. So the getcoveredillinois.gov, the Marketplace website, the Illinois Medicaid website. And if you want to see preview plans and kind of play with the tool and see what you might be eligible for, you can do that through the link where the premium and tax credit estimates can be viewed. And you can also, again, check our website. We'll have all this information on there, and you can reach out to us if you want to schedule an appointment remotely. Thank you.
Thank you.